Hi, this is Dr. Michael Johnson again. I have been gone for an extended period of time. I had a health issue. I had to actually have emergency surgery for a hernia. I recovered from that well, but I developed a fever shortly thereafterwards. And true to protocol, I was advised to remain in quarantine, not only because I had a fever, but because I was exposed to someone who actually tested positive for coronavirus in my work duties. So I remained isolated for about 10 to 12 days. I tested negative for coronavirus on two occasions and came out of that isolation feeling good, no fever, and actually feeling very, very well. But I wanted to address some of the things that come about with being isolated and being in quarantine. And the fact that oftentimes it's not just our physical quarantine, it's also the mental effects of the quarantine, the emotional effects of the quarantine. And I wanted to address all of that with this gospel that Jesus says in John 8:31-32, the truth will set you free. And I want to talk about being set free from the isolation and maybe the fears that we have with regard to coronavirus. And with that, I want to address some common held notions or misnotions. Uh, I want you to very much throw away all of the thoughts, someone actually um, trying to infect us with something in a way that will bring harm to us as a society, as a nation, as a people. This is an event. The coronavirus, COVID 19, is a series of viruses that have come out, and it's called COVID, coronavirus disease 19. It came out in 2019. There are other coronaviruses which we have come through and done well with and survived, and we will survive this one. The truth will set you free. We will get over this. But having said that, there are some things that you and I can do to help stop the spread, and that is the principal thing, is stopping the spread. When you go out, if you must go out, the reason you wear a mask, a barrier, is because every time you speak, every time you cough, every time you sneeze, droplets come out of your mouth. And so wearing a mask or wearing some protective thing over your face is about protecting others. So all you have is a scarf. You don't have a mask, wear a scarf. If you have a mask, and this is all the kind of mask you have, wear a mask. If you are fortunate enough to have an N95 mask that they wear, some of the healthcare professionals can get them, many of them can't, most of them can't, wear this one. This makes it difficult to breathe, it gets hot under here, but I am unlikely to transmit this disease by speaking because it's the droplets that come out of my mouth as I speak. That's how the coronavirus is spread. That's why social distancing is important. That is why staying at home is important. It is crucial. The other thing I want you to be set free from is this notion, and this is a notion that we are right around the corner to developing a cure or a treatment. Right now, the only thing we treat with for coronavirus is the symptoms. We treat the manifestations of the illness. Typically, right now, if you're at home and you have a low-grade fever or a fever and a cough, treat those symptoms. Tylenol, ibuprofen. Ibuprofen is a safe drug for this. Cough suppressants and what other medications that you use for cough and low-grade fever or the flu-like symptoms or common cold, use those. If you get sick despite the use of those, consult your healthcare provider, or if you're very ill, go to the emergency room. As I said, the way we treat this illness is we treat the symptoms. If you're very, very sick, you may end up in the hospital, and a lot of people end up in the ICUs. And the reason people are on ventilators is that we have nothing else to provide. We've done everything else. Now you're in the ICU on a ventilator. There's a lot of talk about this hydrochloroquine, the medicines that's used for malaria. Suffice it to say, it is not proven. In fact, the way we do in clinical medicine, and in fact in research medicine, clinical research, is a medicine goes through 3 trials. Number 1, is the medication safe? Number 2, Is it better than a placebo, or as we call sugar pill? Number 3, is it better than a known curative medication? Number 1, with hydrochloroquine, there are no ongoing clinical trials in the United States because it has proven unsafe. It has actually killed people in both Brazil and France. So there are no ongoing clinical trials in the United States. There are some compassionate uses. I mean, basically, we have nothing else we can try. Let's try hydrochloroquine. But at present, there are no controlled clinical trials because the drug has proven unsafe. It is used in selected settings with people who are on their last hope. So there are no controlled clinical trials of that. So please don't ask your doctor to prescribe these medications for you because there's no evidence that it works. And there is evidence that it is harmful. The other thing I just want to really emphasize in this, is your personal responsibility to not spread this illness. You can be completely asymptomatic, have no symptoms whatsoever, and still have the virus within you. Your immune system may be able to withstand the virus, but the people that are around you, with whom you speak, with whom you laugh, the people whom you may cough around, their immune systems may not be as good as yours. The truth is, you're not just protecting yourself. You're not protecting yourself principally. You're protecting others. You may be asymptomatic and spreading this illness. This illness can be borne on foods. It's mainly uncooked foods, but if you buy fruits and vegetables, wash them and immerse them in water, cleanse them in water. Your common household soap and water will do for your canned goods. If you're really, really worried, use a disinfectant. If you don't have disinfectant, soap and water will do. If you have hand sanitizers, that's good. But soap and water is actually better than the hand sanitizers. It's just that the hand sanitizers are more readily available when you're out and about. You order foods online, get the cooked foods. This virus is destroyed by heat, especially the common heats, 300, 400, 500 degrees. The virus is destroyed by that. It's not destroyed with refrigeration. The virus lives even on refrigerated things. So you buy something that's refrigerated, wash it. Wash your hands, social distancing, wear something to protect others when you're out and about. And most importantly, know the truth. Share the truth. Don't spread rumors about where this disease came from, who started it. That's unfounded. The truth will set you free, and it will help set our communities free. You can reach me, Dr. Michael Johnson, Miriam Medical Clinics, 215-664-8745. Or you go to our website, www.miriammedical.org. Thank you, and God bless you.